Hi there. Hi. Come on in. My name is Doctor Periwinkle. It's nice to meet you. I believe I've got you down for an eye test with laser eye surgery today. Is that correct? Good. Okay. And as this is an elective surgery, I am going to have to ask you to sign a consent form. Okay, we'll do that in a minute. So if I could run through just some very brief questions, okay? And then I'll explain to you what this is going to involve. Brilliant. Okay, so if I could take your name. And your date of birth. Okay. Is this your first time in the clinic, or have you been before? You've been before. Okay, good. Okay, so do you wear glasses or contact lenses? Okay, glasses. Okay, so have you ever worn contact lenses? Okay, I'm asking just because over the past, say, 2 or 3 weeks, have you worn any? Good, because we do encourage patients to try to avoid contacts, try to avoid a lot of eye makeup, and basically just anything that might cause your eye some irritation in the weeks leading up to the laser treatment. Okay, so that's good to hear. Okay, do you have any allergies? Okay, we aren't going to be using anything that will set off your allergies today. And are you taking any current medication? Okay. Good, so nothing that we do today is going to interact with that in any way. Last question, and this is quite an important one. Do you have someone with you in the waiting room who's going to be able to drive you home? You do? Good, because we say that for one day following the treatment, you may not be able to drive. Okay? Good, that's brilliant. Alright, so what we're going to do is we're going to do a little bit of a regular eye exam. So I'm going to have a look into your eyes. I'm going to be checking that there's no signs of irritation or infection in your eye, because we wouldn't be able to do the laser surgery if there was. We'll do a bit of pupil dilation testing with the light, and we'll check how well your eyes are responding to the light, because the laser is quite a bright light as well, so we just want to make sure that your eyes can handle it. Okay, so the kind of laser I've got today is quite a new piece of technology. It's just in the shape of a pen, a bit like this one. So there's no scary devices or anything like that, and I'm not going to be holding your eyes open with anything, because I know that can be quite uncomfortable. So if you need to blink at any point, you can blink, feel free to. If you need to look away for a second, that's okay too. The laser is quite advanced, so it will be able to follow your eye around and pinpoint exactly where it needs to latch onto, and you can just be natural, okay? Good. So before we go any further with the treatment, if I could just hand you this pen. Good. And can you see the consent form? Okay, use this one. Here you go. Good. And if you just have a read through that, and then a little squiggle signature down the bottom, and today's date. basically it just explains the risks, the benefits, the cost, because obviously this is elective, so it's not free, and the payment options that you've chosen. Good. Thank you. Thanks. Alright, so first of all, I'm going to pop some gloves on and then have a close look into your eyes with no light, okay? So if it's okay with you, I'll be pulling down the eyelid and also pulling up, just so I can get a good look on the inside. Okay? Perfect. So I'll just get these warmed up because they are going to be a little bit cold. You don't have any sensitivity to gloves, do you? No? Okay. Alright, so I might ask you to look up and down and left and right and what have you, okay? Perfect. Just gonna come over to this side first. Just pulling down the lid there. Okay, that's alright. Just look up. That's it, look up, look up, look up. Okay, good. Right. Let's just go around to the top now. Okay. If you could look down. Look down, look down. Look down. That's good. Okay. Okay, look left and right for me. Good. Okay. So that's good. No infection in there, no redness. It looks quite healthy and there's no scratches or tears, anything like that. If we were to do laser eye surgery and there was an infection or a tear, it might sting and it also might not be effective. So we just make sure that the eye is in good condition. Okay, let's have a look at the other one. Yep, I'm just gonna pull down. Okay, if you look up. Yep, that's it, look up, look up. Keep looking up. Okay, good. Let's have a look at the top now. Good, good. You look down, look down. Keep looking down, that's it. Really good. Okay, and if you wouldn't mind, move your eye left and right. Good. Okay, right. That looks fine. Right. So I'm going to get out my eye chart and we'll just kind of have a look and see where you're at the moment, okay? Good. So if we do this completely natural as your eyes are, so don't put your glasses on or anything. Okay, so let's just see which line can you see down to quite clearly. Okay, good, so that one just two above the green line. Good, okay, so what laser eye surgery is hoping to accomplish is that without glasses you'll be able to see down all the way down to here and maybe even down to here. Okay, without glasses, so that's quite incredible really. Laser eye surgery is 100% effective as long as it's performed correctly, which it will be, I assure you. And yeah, it really is quite a good invention. So let's just run through this chart a little bit, okay? And let's just see, get get a baseline idea of where we're at now. Okay, so tell me which letters you can see on this line. P, good. E, C, good. F, yep. D, okay. Did you want to attempt the next line? Okay. E, yeah. And D, good, good. F, C, yes. Z, B, good, perfect. Okay, how are the next two lines looking for you? A bit harder. Okay, let's just have a go at this one and then we will stop. F, good. It's okay, you can take some time. Yep, E. L, yeah. O, perfect. B, good. Z, and D. Okay, good. So, does it start to get blurry? It does. Okay. So, with laser eye surgery, these lines will become clearer to you. It may not go into effect immediately, as in, as soon as this session is finished, you might have some blurriness, some haziness, but within 24 hours your vision will be perfect or near perfect. And you won't have to wear your glasses very much at all. Okay, great. Okay, so the next bit is we'll just do some of the light tests, and this is going to serve two functions. I'm going to be able to check your pupil dilation, and I'm also we're going to be getting your eyes accustomed to a bit of light. So this light isn't too bright, but the light of the laser is very bright. So we'll start with the duller one, and then hopefully by the time we move up to the other light, you'll be a bit more used to it. Okay? Great. So I am going to look closely into your eyes with this. Let's just turn it on. Do you see the light is quite dull, but it'll be alright. So I'm going to be bringing it in and out to look at your pupil dilation, just to check that that is healthy and normal. And I'm going to ask you once again to look up, look down, and look side to side, okay? We'll do this one eye at a time, so if you just close that one, hold it shut, that's it, okay? And it's moving closely. Good, yep, just look straight forward to begin with. Looking at my nose. Good. And then look up. Good, good, good. Look up, look up, look up, look up, look up, look up. And then look down, look down, look down, look down. Okay, look left, look left, look left. And look right, look right, look right. Okay, perfect. You can just have a blink, shake it off. How did you find that light? Not too bad. Okay. Okay, so we'll do the other side now. So that one closes. And then let's just move the light in now. Good. Looking straight forward at my nose. That's it. Perfect. And then look up. Look up, look up. Look up, look up, look up. Look up, look up, look up. Good, good. Look down. Look down. Look down. Look down, look down. Look over to the left. That's it. That's it. Look left. Look left. And then look right. Look right. Good. Okay, lovely. So we'll just do a little eye tracking exercise, okay? Just check how well your eyes can follow this light, because I will ask you to attempt to follow the laser light. Don't worry if you can't follow it 100%. The laser will be able to follow your eye movements, okay? But for now, just do a quick eye tracking exercise. So if you look at the light, good. Perfect. Okay. Try and keep your head still. I'm going to be trying to move your eyes closer to the center by bringing the light up to the middle, okay? Yeah, so you go a bit cross-eyed. That's it. Good, good. Perfect. I'm going to move the light across the horizontal plane, okay? This plane. Yep, just following it with your eyes. Perfect. I'm going to move up and down the vertical line, okay? The vertical plane. Nice smooth movements of your eyes there. That's really, really good. Well done. Perfect. Okay. Turning that one off. So what I'm going to do now is explain to you the step-by-step procedure of the laser eye treatment, okay? So first up, I'm going to be measuring your cornea. So the cornea is the clear part of your eye, okay? And it's kind of on top of everything else. So what I'm going to do is measure it, and then I'm going to give your eyes a wash, a cleanse, okay? And then following that, we'll be applying the local anaesthetic eye drops. So this means that you won't be able to feel anything. So we'll pop 3 drops in each eye as standard, okay? And then we'll leave it for a few seconds, maybe a minute, just to check that it's worked and that your eyes are sufficiently numbed, okay? Then what I'm going to do is bring out the laser, okay? And I'll warn you, it's very bright, and we're going to be using the laser to create a slight incision, which is going to create a flap where your cornea will be able to be gently peeled back, okay? I'll be using tweezers to do this ever so gently and precisely. And then I'll be using the laser to reshape the underlying corneal tissue. So we pull back approximately the top 20% of the cornea, the outer layer, okay? And then the laser reshapes the underneath part of the cornea into a better shape. Okay, so this is going to allow light to travel back to the retina more correctly. This is going to give you clearer vision, okay, because when the light travels back to the retina, if it isn't quite in focus, then that is what creates eyesight problems. So reshaping this cornea will ensure that when the light travels back to your retina, it's completely in focus. Okay? And then what I'm going to do is reapply that flap, just completely cover it over again, and no need to have glue or stitches or anything like that. It will just attach itself and heal up nicely. Okay? And then after that, you might be blurry for 30 to 60 minutes, which is why we recommend that someone drives you home. But rapidly, within the next 24 hours, you'll notice that your eyesight starts to become much better. So it is worth it. There's no long-lasting side effects, although I will give you eye drops because your eyes can be a bit dry following on from this. Even if your eyes don't feel dry, I would still advise you to take the eye drops anyway, because the local anaesthetic could be numbing any sensations, so they might feel fine to you, but they might actually be a little bit dry. Okay, and within the next 12 to 24 hours, the anaesthetic will wear off as well. Does all that sound okay? Good, okay, so I'll talk you through it as I do it. I'm just going to use this very tiny, precise tape measure to measure your cornea, okay? Good. Blink if you need to, by all means, but for now, if you could just try and make your eyes really wide. Yeah, and kind of just don't focus on anything in particular, try and stay still. Good, okay. Okay, so I'm looking at the width of the cornea there. This is so I know how much to take back, and then the depth. Good, and the other one. That's it. And then the depth. That's good. Okay, right. Okay, so we're going to be doing the eye wash now. So we're going to be using this cleansing water, and it's completely sensitive and safe for eyes, okay? Just be popping it on there. Okay. There we go. So I'm going to be just washing this into your eyes, okay? Just to make sure there's no dust, bits of makeup, eye gunk, you know, sleepy dust. Nothing like that, okay? Good. Good. It's not uncomfortable in any way. Good. Good. I'm just going to pull down a little bit there. Okay. Okay, good. I'm just pulling up. Pulling up there. That's it. Perfect. Okay, let's do the other side. I'm just going to turn over and use the other side of this. There we go. Have you ever had any kind of treatments on your eyes before? No. Okay. If I can just pull down your eyelid now. Good, good. This is quite important because when we peel back the cornea, we want to make sure there's no bits and pieces of tiny particles that could get trapped underneath when we flap it back over on top. Definitely want to make sure that eye is completely clear. Okay, perfect. So if you're ready now, we'll be doing the anaesthetic. So it's not going to make you sleepy or anything. Your eyes will be fine. They just won't be able to feel the laser. Okay? Do you need a break or anything before we do this? Good. Okay, let's look up to the ceiling. Okay? So I'm going to be doing a drop in the middle, and then I'll be pulling down, doing a drop, and then I'll ask you to blink so that it washes all around, and we'll be doing a drop on the inner corner as well. Okay? Okay, yes, that's it, look up, drop, there, good, just gonna pull down, drop, and then on the inner corner, good, can you blink that around? Good, so it just spreads all the way around, quite evenly. Okay, good. Let's just give that a second. And do the other side. Okay, so one approximately in the middle. Good. Just pull down there. One in there. Good. And then one on the inner corner. Good. Okay. Yeah, same as before. Have a blink. Lots of blinks. Let that spread all the way around. Just give that a minute to take the full effect, okay? You all good? Okay, so I'll just feel around your eye. Just tell me if you can feel it, okay? You'll probably be able to sense the movement against your skin, but just let me know if you feel normal or if you feel a bit more desensitized. Okay, good. I'm just going to feel on your eyelid and very close underneath your eyes, okay? Can you feel that? Okay, right. I'm gonna press down just a tiny bit firmer, okay, on your eyelids, okay, and underneath. So you might be able to feel it on your skin, but can you feel anything? Can you feel the pressure on your actual eyeball? No? Perfect. Okay. That's good. move on then to the laser. Okay, so as I explained to you, the next step is to make a tiny incision and peel back the cornea. Okay, I'm going to be using the laser, and I'm also going to be using the tweezers. Okay. Alright, now this is a laser pen, it's not just a regular flashlight, so just try and stay still, okay? Let me know if you do feel anything, but every patient has said that this is completely painless, okay? Good. Right up close, up close, up close. Good, good, I'll just put that. Good, okay. So now, I'm going to reshape that tissue underneath. If you try and look at the light as much as you can, if you can't, don't worry. Okay. It's okay if you need to blink. You're doing really, really well. Good. Good. That's it. Well done. Well done. Okay, perfect. Okay, let's just reattach that cornea for you. Okay, if you try and blink. Good, good. Just make sure that's properly in place. Good. Okay, we'll take a second. How did that feel? Okay, so we'll do the other side if you're ready. Yeah? Okay. Right. So just have a little feel around there. Good, good. Bringing out the laser pen now, okay? Good. Okay. Okay. Just grab that there. Peel it back. That's it. Just on there. Okay. Right. Now we're going to reshape. Just try and shield that eye, okay? Because that one's had the treatment now. Yeah, maybe close that one. Good. You're doing great. Perfect. Perfect. That's okay, don't worry, you can blink. This pen is quite advanced. Okay. Good. Okay. Let's get that cornea back on. Perfect. Do you want to blink for how do your eyes feel at the moment? How's your vision? Good. A little bit blurry. That's okay. Completely normal. Okay. Healing is rapid, so this time tomorrow you'll be completely right as rain. You'll be able to see much better than you have in a long time. Okay? We sometimes say you can come back for follow-ups if it starts to deteriorate again, but we'll just check up on you in a month and we'll see how everything is. Okay? Good. But usually these are very long-lasting treatments. Okay? Good. So you're free to leave as long as you've got someone waiting for you. Good. Okay, remember, no driving for the rest of today. I would see how you feel tomorrow, but use common sense, of course. Good. Okay, we'll see you then. Bye now.